Hello, Dr. Preeti. It's my honor and my privilege to have invited you to the Humanopathy Academy, and I will be very pleased to hear your presentation about all the things you do and about your specialties in autism in children. So you are welcome, and I will be very glad to hear your presentation. Thank you.
Thank you, Nikos. Thank you for a warm welcome. And I think it's a privilege to be here on this platform today. Uh, I'm so glad that we met a few days back, and we are taking this to the global level. And I'll be very happy to share my experiences with autism over the past few years. So let me first start with a little a line or two about my experiences and how it has evolved. Because I am practicing since more than 2 decades, homeopathy only. But the day when you start your practice, you may, if you are lucky enough, you may get such specialty patients. That is very much possible in India because homeopathy is really looked up to. But what happens is that when we do not have the hands-on experience, we go by the textbooks or by what people have told earlier about it. So going by the textbooks, when our stalwarts had written them, autism was not on the table, honestly. But then we had, with practice, we understand that we need to evolve by the basic foundation principles that Dr. Hahnemann and Dr. Kent, Borick, and all of these stalwarts have laid for us in the textbooks of homeopathy. And these principles are so much applicable to all the newer and newer disease or conditions that we are now facing because of the advent of science. We are able to label these diseases. But the homeopathic science is so wide, the foundation is so wide and so rock solid according to the law of nature that we are able to apply all of that which was discovered 200 years back, 200 plus years back to the modern medicine even now. And that is the beauty of our basic principles of homeopathy, which I will try to bring out, maybe if not today, in the upcoming lectures if we do on autism. So today, basically, let me share my PPT. We have the share option here. Yes, it's visible. Is it visible? Okay, perfect. So when we talk about autism, the thing is that it is a spectrum. Uh, we cut it short to autism. But when we say a spectrum, it means not just the labels of the diseases that we are seeing in this umbrella, but a lot more goes behind it. A lot of presentation will vary. The intensity of the condition will vary. The challenges that the person himself and his acquaintances face will vary, and the outcome will vary. So we are going to take a little dive into these things from what we know to what we should know and what we should learn in between the lines, as I always say. So let's begin. Um, I'm just giving a brief of what we are going to learn today. We are going to start with what we know, what we have looked up in the textbooks of medicine, or in, maybe these people who come to us nowadays are people who just look it up in Google. So we have to understand that as well. The diagnostic criteria, the CARS code, and the causes that are already put up there. That is the physical causes. They talk about genetic causes, but we are going to take a little more dive into the causes more than what we already know. Then we are going to discuss about the homeopathic approach, and I'm trying to give a roadmap to how I work in autism cases so that people, maybe they can start on that map and they can have their own journey later on. And we'll talk about the larger perspective of the management of autism cases and what should be the outcome when one person is on homeopathic treatment for autism. If that is good enough, I'll go ahead. So, what is autism? When we understand autism, we know we have the arbitrary definition of autism, that it is a condition with a problem in social interaction. There are no eye contact, the communication is not there, or it is poor. There is a speech delay, or there are repetitive actions. All of these, it makes a mixed picture. But on a broader scale, in a broader definition, that autism is a neurodevelopmental condition, which means it is not just neurological condition, or it is not just a developmental delay, but it is a combination of both with differences or difficulties. So there can be this spectrum, so there are differences, and there can be difficulties in social interaction, in communication, in sensory processing, the repetitive behaviors, and there is focus. How can I reduce this hide video? Hide video panel. No.
Look fine.
Okay. Yeah. This is good. Okay. So there could be repetitive behavior in the case, and there could be very niche focused interest of the person. That is uh, a nowadays I'm getting a couple of cases where the parents are proud about that particular interest, which the child is very like a genius, and it is called something like a savant syndrome. Also, that also comes under autistic spectrum. So, what are the facts about autism? It is like, as I said, it can vary. The presentation can vary, and the characteristics of the presentation can also vary. And the kind of support they need could be a minimum support to a maximum of even 24 hours support. And that is why many times when the minimum support is needed, we call it high functioning autism, but it goes undiagnosed in childhood. And that I also came across something when I was looking up, that the children are also masking this kind of uh, what you say, the deficit in the development. They are able to mask it, and parents are not able to understand that this could be a part of autism too. And the WHO criteria, the prevalence shows 1% of children, that is one in every 100 child, is facing autism. That was back in 2021, and I believe now it is increasing globally. I think with the pediatric kind of cases we see, every 1 in 10 children are kind of more or less into this autism spectrum. So people are really looking up to something for help more than therapies. We need to diagnose it also, even if we are doing homeopathy, because if we don't diagnose, then we don't understand how we should be managing it further. And the diagnostic criteria, it is according to the DSM-5, and it says that at least 2 of the following behaviors have to be present in the child before it is labeled under the autism spectrum. That is the repetitive behaviors, which includes also echolalia. That is, not many times they keep repeating the same phrases again and again, or maybe they repeat things after what is told to them. As for what is your name? So they will say name, 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 name. They will not be able to answer further. That is one small example. Second, very important and very difficult to deal with for the parents or the caregivers is they are resistant to changes. So therefore, if they like one particular toy, they cannot give up. If they like one particular area, they cannot go outside it. If they like one particular friend, they will not leave hold of him. If they like one particular routine, then they will not be flexible with, and they'll not depart from that routine. So that is very strong. Almost all children, they particularly show this kind of character. But there could be, it is not necessary, because only 2 out of this 4 criteria should be matching. to be diagnosed with autism. The second is intense interest in any one particular activity. Like we spoke before, there's a lot of focus in one activity. Now, I had a case which I'll be talking about later, but in that case, the child was very much obsessed with numbers. So wherever he would go, he would read numbers, he would catch anything that is with a number, and he would start calculating that. He was completely obsessed with just numbers. Then there is sensory reactivity. So these children would not be reacting normally to the sensory impulses like noise, light, or crowd also. Wind also many times we have noticed it. The difference in temperature, difference in pain, they will either exaggerate their responses or there will be no response at all. And nowadays, the DSM-5 criteria was also little backdated. The most recent criteria says that the autism also requires difficulties across 3 social domains. So what are these 3 social domains? The social emotional reciprocity. That is when we ask, in homeopathy case taking also, what we do by default with all children is that we ask, we want to know how sensitive the child is. So what we ask to the parents is that if one of you, who is he more attached to? There, most of the times what happens is this is very misleading. Whoever is attached to the child more, they usually say the child is attached more to me. So then we have to ask, okay, if he's attached to you, then how does he react when you fall ill, when you are not well? What does the child do? So many times parents say, okay, oh, gets very worried, sits by me, holds my hand, asks me if you need some water, when will you get better, mama? But with autism children, there was one case where the mother was so affected. He said that, okay, he keeps binge watching the television, but that he overcame that with my treatment. But then the mother was worried that she said that he doesn't, I can see in his eyes that he gets affected when I am not well, but he doesn't do anything about it. He doesn't, he looks at me like that and then he goes away as if he's confused. That is what is meant by this social emotional reciprocity, that he has that kind of affection or emotion of empathy for his parents, but he's not able to articulate it. He is not able to take action about it. Then there is non-verbal communication. There is non-verbal communication, but they are not able to portray it the way the remaining children portray. For example, there could not be consistent eye contact, or if somebody makes an eye contact, then they don't understand how to reciprocate to that. And so as a result, the third person thinks this is very weird. This is how, even as socially, when we come across our children, when we are not doctors, we still understand, oh, something is wrong with that child. So that non-verbal communication part is little, I should not be saying, but to understand it more clearly, it is more weird. And therefore, their voice modulation will be very different. They might be very high-pitched or very flat-toned or something like that if they are talking. Then they are not able to even understand other person's body language or other person's facial expression, which is why they are not able to even reciprocate to that. Then the third thing is they are not able to form or maintain relationship. So naturally, because of not having cognitive empathy, because of not understanding the non-verbal communication, it's very difficult for them to interact with someone. And they find themselves very lonely, secluded. And even the caregivers don't feel that we are getting any emotional reciprocation from them. In adult life, they might experience difficulty in romantic relationships, and there might be loneliness socially also. They don't make friends. And then, as I said, there is masking in all such mechanisms if it is a high functioning adult. Moving on, if we leave them completely by themselves, like no therapy is given, it is not even diagnosed, then what might happen? that is a natural progression of this condition. They might land into self-injury. They have self-injury tendencies, or social exclusion, or there could be a changed family dynamics altogether, which is really bad. And we are really blessed to have come to this stage of scientific research where we are able to diagnose such cases. Otherwise, earlier, imagine in our generation, when we were kids, how many of our peers, our colleagues would have gone undiagnosed. And later on, we find them really socially excluded, lonely, and depressed or underperforming. So
Yes.
we must intervene and we must do something about this. So they need help, they need advice, appropriate advice, and they need support. And sadly, what is understood by support for autism, when you just Google it up, there are autism support centers, but nobody says that we are really able to do something for this condition. I understand it is a developmental condition, but then there is much more than just giving support or just pacifying them or their family. Much more which we can do. For that, we need to understand more insights into autism. So just knowing what it is helps, but it doesn't help enough. Even Dr. Hahnemann has talked about the cause and effect. That whenever there is something that is seen, like here, there is this tree which is nice and green, and it is all, probably it is blossoming, it has fruits. That's the effect. Its cause is because it got the rain and it got the shine. Similarly, if there is a condition, then there has to be a cause behind it. And we need to understand that, to understand the interconnectedness of everything around us. So when we try to understand the cause from the medical perspective, that is the medical books that have published, they would always say, and it is a fact also, that there are theories of it is a multifactorial condition. Neurodevelopmental. So when there is development happening inside the womb, there is some problem. Therefore, it is genetic, what we can term it as, during the prenatal life and immediately after birth, that is the perinatal life. So whatever influences of the environment, like probably there was a vaccine theory, but it failed. But then whatever the chemical influences with the mother, the kind of toxic chemical exposures, or some drugs might have been there, which were taken during the prenatal life of the child, might have affected and caused a genetic mutation. But then at least hundreds of genes have to really mutate for this kind of a condition to develop. So it has a genetic, which is an inherited basis also, according to few theories, and multiple gene interactions. As I said, hundreds of genetic variants have to be there for this condition to develop. And there could be comorbid genetic syndromes with them. For example, the child is functionally labeled under autism spectrum, but there could be some genetic syndromes with which the child is born, and it is secondary to that genetic syndrome. That is also possible. I'm not taking the details of it because these genetic syndromes are all very rare occurring syndromes, and we will have to spare some time to understand them if I had included them. So let us just understand it up to here. And then if we understand, we try and think, why would these genetic mutations take place? What inside the womb affects if there is no uh, so many cases have I treated here. There have not been a single cause that I could isolate for the genetic mutation, like the chemical causes. There haven't been any history of infections during the pregnancy of the mother. There haven't been any history of medical treatment, or there haven't been any history of exposures to harmful chemicals. Yet there were autism cases. So that makes us think, what could this be? and why it could be. So what we understand is from this kind of theories and concepts, which I have often, most of the times found in my practice. It is derived from metaphysical insights. Sometimes I have used the GNM theory by Dr. Reichhammer. We understand it by the theory of milieu interior by Claude Bonnet, and we can explain it scientifically on the basis of PNEI axis, the psychoneuroendocrine immune axis. And we understand now in homeopathy, with the method that I'm following, uh, we understand it from the we label it as psychodynamics. So the dynamics that goes behind the psychical causes and the psychodynamic causes behind all these big genetic mutations and all. That is the psychodynamic causes. I'm just touching it here and I'll explain it in a slide in some time. So what are the deeper metaphysical insights? If a person refuses to consciously assume some part of himself, that is its shadow, the shadowed part, the negative part, the rejected principle, which his mind himself rejects, that, oh, this is not something that I should be doing, or this is not something that should be happening around me, and he doesn't adapt to it positively, then it is introduced into his body and it manifests as a symptom. So we have no choice but to experience that which his mind has rejected. So something that is not acceptable to him, something that he doesn't wish to have around him, that causes a disease in a nutshell. So the whole theory that we understand led by C.G. Jung's revolutionary metaphysical insight, is that we need to adapt to our circumstances, we need to adapt to our surroundings, and not get influenced by them. That is the whole crux of what is written here, right? We need to embrace our shadow, he said, and we need not to resist what we resist. If we consider something bad, only then it affects us. So I wish I could explain this. I'll explain this probably some other time. Even the physical symptoms that we experience, for example, acute gastritis, acute diarrhea. I ate something and I got diarrhea. It was spoiled. That, it is not that spoiled food that often causes diarrhea. It is our thinking, because we have rejected what we've eaten. At the same time, we have eaten it. And that is how the body throws it out. That brings on the diarrhea.
Yeah.
So even this principle works while treating acute diarrhea dysentery cases. And it is just so beautiful. Okay. So coming to the PNEI axis, which I already talked about, I'll skip this slide. Now the psychodynamics. For the psychodynamics of autism, I have used the reference of a book called Knowing Ourselves by Yoman Romero. It says that why a person is autistic, because they are fleeing from a very painful situation in their environment. They are not accepting it. And first and foremost, their basic delusion is that they think this is a hostile situation. And second is, because they think it is a hostile situation, the body's mechanism is to flee away from it. Now, the child chooses autism unconsciously to escape from the reality of his family and the world around him. So autism, the mechanism is one adoption of our body is fight, flight, and fright, right? Second adoption is uh, just not to escape. I mean, not to accept and escape, completely escape. So by doing something wherein I'm here, but I escape. So I am absent mentally. And that is what we see in autistic cases. They are in their own world. They just don't respond, in a nutshell. So because they are saying within their mind, I refuse to deal with such a dirty world. This is one probability. Second probability is they have felt rejected before birth. So it is the child, the first thing situation is when the fetus in the womb feels that way. So many times when we come across the cases, we ask the parents whether they wanted this pregnancy. And many times in autistic cases, we find that the parents and the mother especially didn't want this pregnancy, and she got pregnant. So that is the first situation. The child feels this is not a world which I want to be born in. And the second thing is they feel rejected even before birth. So this is when generally this kind of emotion is passed on to the fetus from the mother's emotion. So mother also has felt rejected somewhere, and that happens to the child. So he rejects to deal with the physical reality of the outside world because their sensitivity has been abused. And therefore, they feel that I must be silent and expressionless for not being accountable. I'm not counted here. I don't exist. And therefore, I don't want to talk. I must be silent. I don't want to express. I don't want to be emotionally close to anyone. I'm so sensitive that if I show myself to the others, they will hurt me. What I see around me, that hurts me. And therefore, the child doesn't make an eye contact. So that is so much applicable, replicable in cases that is the reason we always use this theory. And now, therefore, we need to understand before taking autism case that what should be our goal in autism, what it is that needs to be cured. That is what Dr. Hanneman has mentioned in Organon. And now in practical world, we need to understand what is it in the patient that is difficult and we need to remove. First and foremost, we need to understand that it is a neurodevelopmental condition. So we cannot tell the patient that it is going to be reversed. It is not something, it is not uh, a disease that can be cured. It is the lack of development. So we have to tell that, okay, this is the stage at which you have come. A 15-year-old boy versus a 5-year boy. A 5-year-old boy has better prospect than a 15-year-old boy because the brain develops in the first 5 years of life and not later on. So the prospect of him getting a better development in the intellect and the responses is far less than one who comes early on in the life. That is what we need to understand by this. And we need to also understand that we are going to still modify the prominent characteristics. We've seen all the characteristics that form autism. So we are going to modify only those which are challenging to the life of the individual and of those around him, and which are impediments to his personal well-being. The disabilities can be modified using homeopathic similimum along with the cognitive therapies. So I always say, okay, only cognitive therapy is not going to work unless it is just a simple case, which is on the left side of the spectrum. When it is a serious developmental disorder, you will need to give something like a homeopathic similimum because it acts at the root cause, like we said, the rejection principle and all. The cognitive therapies don't act over there. They just try to give more and more conditioning to the child. So when they had done together with homeopathy, there are far better prospects, far better results. Only homeopathy also sometimes doesn't work because, well, the development has started, but the child doesn't understand or the parents don't understand what has to be done. Okay, child is developing intellect, but his behavior is still not in place. He's not able to give because emotional and intellectual development both have to be done. So emotionally, if he doesn't understand the body language of what I'm teaching him, then how is he able to learn? He'll not be able to learn. Therefore, we need to take them for the therapy wherein there are specialists and experts who understand how to communicate with a autistic child. And therefore, both hand in hand is always the best. While the autistic trait may persist throughout life, it is found that homeopathy can be used to develop healthy coping mechanisms and make the individual more acceptable to the non-autistic society. So as a resultant, what we say is that if it is a child, then they put them to the special schools and schools for the specially abled. But later on, as the treatment progresses, we are so happy to find most of the cases, they move to the normal co-ed schools. the mainstream schools. And that is what our goal should be, that the child is able to cope up with non-autistic society as well. So now, having said that, let us understand how we approach cases in homeopathy. So in homeopathy, because I was told that this webinar might be seen also by non-homeopaths. So I want to tell them that in homeopathy, when we approach any case, we understand the disease, we understand the diagnosis, we send for the diagnosis or we diagnose them. But then we put the common symptoms of the disease, like all the common uh, picture of any autistic child, we will put them aside in a box and we will try to see what is uncommon other than the traits which are other than the autistic traits. Okay, now this is little difficult to understand. An autistic child, if he comes to me and he's, as I said, that one child who's obsessed with numbers, he keeps talking numbers. Do I consider it or not? Yes, we consider it because it is numbers. It is the same thing that keeps happening again and again. We say repetitive behavior, echolalia, that happens. But why numbers? That becomes the characteristic in that child. Okay. And second is, it is persistent. No matter what you do, it is intense, it is prominent, and it is morbid. Because it makes the child not want to do anything else. That is, it affects his development even further. That is morbid. Morbid means something that makes him sick. Therefore, we have to consider this while taking the symptoms of totality. Okay. So now what we understand step by step in a case, the what of the case. It means we don't need to ask this to the attendants or the patients. Usually they present to us with this. They start talking about what is wrong with the child. What is the challenge with the child? What is it that is not they are not able to manage using other therapies or at home, or what is really making them worked up, and what are they seeking treatment with us. That is the what of the case. Now what does the child do, and when we start the history and all of that, it is very important in all pediatric cases, but especially with autism, that we need to have this child in front of us, even if it is a video consult, online consult. Always say that the video has to be placed upon the child. We need to observe each and every action of the child, even if he is just watching TV. Let it be. When the mother in the same room is talking and he is besides her and watching TV, there would be something, some movement will be there, which will be very peculiar to the child, which will be very uncommon. And whatever the mother is saying, for example, the mother is saying that he is very mild, he is like this, whoever can come and beat him up. But you look at the child, do you feel that energy, that he could be that mild, that docile? You understand more when you observe. And that is why you need to observe, especially when the children or anybody who is non-verbal. You need to understand their non-verbal communication, their body language. So that is what is meant by observation. Then we need to understand the dynamics of the patient with the environment. If he's in the clinic, then with the clinic environment, because that is an uncommon environment out of routine for him. So that is the time when his coping mechanisms are going to be right there in front of us, where we can catch them. Because in homeopathy, the only thing we need to catch is the uncommon presentations. And we can aggravate the child by bringing him out of his usual environment, bringing him there in front of us, and what uncommonly he does when he finds it hostile for him, or not hostile, but he finds it different. That is what we have to pick. Then we need to focus upon the dynamics between the attendants. So if parents are attending, mother and father, then what is it? How is their dynamic in between? A lot of cues can be obtained from there. Likewise, then we need to understand if nobody is there in front of us, only a single parent has come, and then we need to understand who all are there in the family, how they are with each other, what they do, their socioeconomic background, their education background, and all of that. because it has an impact upon the development of the child now outside the womb. And it can give a very important cue to what could have happened when the child was in the womb. We need to understand the nature of the parents who spends maximum time, because so many times it is perinatal. If the child hasn't got enough care and attention in the early infancy, that might also lead to this trigger of autism and worsening of the condition. And as I said, the challenges that the parents or caregivers are facing. So that is what of the case. Very, very important. And from here, you can form a rock base and you have to move further. Then we have to see how, that is the observation will give how the patient is coping here. And we have to ask how he does in different circumstances outside our clinic also. And whatever triggers him, what is his response to those triggers, can give very I can say individual cues to the case. Why of the case? As I said, we need to delve inside the cause. Why did this child have autism? We need to understand the history of mother's emotional state, physical, medical state, everything. But most important is the dynamics of the mother with her environment since conception or around conception and during pregnancy, and the physical state of the mother as well. The history of parental conflicts or stress perceived by mother around and after conception, during pregnancy, history of illnesses or traits in the family, and how did the mother also cope up. We are talking about the child coping up. We need to understand also how the mother copes up, or she coped up during her perceived stress during pregnancy. That would give us to the take us to the why of the case. And then what we do with all this data is we start working. We form a totality. The totality, when we form, the first precedence is given to the cause. And therefore, in repertory, we have to use the repertory. In the repertory, the first three rubrics should relate to the cause. It can be found under ailments from section of the mind section of the repertory, or the delusion, the whatever things were perceived as not in favor, or whatever they didn't like, they have to be looked up in the delusion section of the mind chapter. And then the third rubric should be the characteristic nature of the child, or the characteristic coping mechanism of the child, or his characteristic sensitivity. It could be something that is labeled under autism, but it has to be very persistent and very prominent in the case. We have to then, whatever remedy comes, we have to go through the materia medica, the provings, and the source. Why more than materia medica is because many times we, especially in autism cases, we come across very uncommon, rarely used remedies. So we need to understand them from the source. Now, source language is something which is like this autism babies are not yet into the human world. They are still in some world outside, the universe, outside our universe. And the source language of the remedies also are non-human languages. So looking up more than materia medica, looking up into the source is much far yielding in cases of autism. And that has helped me immensely. Then we need to understand the potency selection. So what happens is we have learned in our textbooks that we need to, in mental cases, we need to use higher potencies. But many times in autism, higher potencies are aggravated. So now again, it depends upon the case. If it is a mild case with no stimulus, a lot of stimulus is required, then we can go for a higher potency. Otherwise, if it is a case of aggression, or where we understand that it is a kind of autism on the spectrum of schizophrenia, then we have to start with 30. And we should have minimal repetition, minimum dose, minimum repetition. And follow-ups, managing the follow-up is very pivotal, because these are all long-term cases, and development happens every stage. So I generally take follow-up every month. a very detailed follow-up with all the evaluation. First and foremost, you need to be prepared that the parents, especially the mothers, will be worked up if it hasn't been a good month as expected by her. So she's going to just blah, blah, blah about everything. You need to spread it out. You need to start from the first point first and backtrace the development right from where it started with you. And then look at the larger picture. Look at the well-being of the child. Ask for the triggers, whether the triggers that were reported last time, have they still been triggering? And thus, we need to also again observe the child. We get much more idea about what the mother is saying. And thus, we should regulate the repetition. Otherwise, what happens is if by unjudicious repetitions, as I said, because the mother is inciting us a lot, that could the cases have got spoiled with me also that has happened. And then you never come back to the remedy that I've given before. Then, but if there are coexisting conditions like aggression, depression, or schizophrenia, then evaluation or the history given by the mother during follow-up should be not filtered straight away. It should be really thought upon. You should be really vigilant and really cautious with these children. So, what should be the treatment outcome? First and foremost, it will go in this. Most of the, if it is in homeopathy, we call Herring's law of cure. In autism, unfortunately, there is no such law. But what I have observed is in this sequence, the follow-ups go. The first follow within a month or 2 months, the child gets manageable. Then starts engaging with near ones. We were talking about empathy. So he starts engaging with the near ones. Then he starts becoming articulate. He might hold the mother's hand. The mother might feel something, oh, my child is my child now after a long time. There is the learning ability also develops because he starts defocusing his attention from one thing to multiple things as normally we do. Then the speech, if the child is not talking at all, then the speech doesn't start suddenly, but it starts with babbling, just like a normal milestone that comes in in a young child. Babbling followed by nonsensical speech, and then there is sensible speech. There might still be echolalia. So this repetitive action and this it goes very last in the cases, and the social skills and acceptance that comes. And I think that is the best outcome. And till if the patient continues, we can hope for better ones. Usually, when there's social acceptance, the treatments is not very meticulously followed. And this is up to how we have seen in our patients. So I think that's about it. The general scope of homeopathy that we just spoke about. And it is so good to see such children, where they are included socially among the peer group and they are really happy and back to our world. It is
Definitely, Dr. Kruti. It has been an amazing presentation, and I'm very glad that we have you in the Humanopathy of Academy of Humanopathy. What I want to point out is one of the things that impressed me from your presentation is that the physical body, the physical reality adapts to the needs of the incarnated soul or quantum body, or what we can say it, whatever. The second thing is I want to present you properly, and I have to say that you are a homeopathic medical doctor from India. You are very skilled. You impressed me from the first time I met you. You are so grounded, and you always want to bring results. So that's why we decided to have you in the academy, and we are going to prepare a full course about autism and about different mental or other conditions that you deal with homeopathy. Of course, homeopathy is a complementary medical approach, and so we are complementing Western medicine, but through this collaboration between the two difficult therapeutic systems, we can bring results, and that's the spirit of the Academy of Humanopathy. And I'm very happy that we will share this information with our students, but globally. And I will be very happy to host you again in the Academy for another webinar. But also soon we are going to have a full course from you for our students, but also for homeopaths and medical doctors, because to proceed further, you have to have the basic knowledge. That's why in our postgraduate program, we provide training in homeopathy. It's one of our main courses. So people and students and medical doctors can build up their knowledge so that they get benefit for all your teachings and other doctors' teachings. So I thank you very much. Thank you for your time and all the knowledge that you have shared. And hopefully we will speak again soon.
Thank you, Nikos. I hope this really works for all of our viewers, and they are really inspired to work for the cause.
Yes, definitely. Definitely. Thank you, Dr. Preeti. And we will speak soon. See you.
Sure.
Bye-bye.
Thank you.
Bye.